ये पूरी रो खाली पड़ी हुई है, ठीक है। आओ इधर आओ, बैठो, बंद कर दो, नो डोंट अलाउ एनीबॉडी एल्स टू नो। Okay, so today's class is on a very classical bacteria, a group, genus, which is associated with different kind of disease, but mostly intestinal disease. That is Vibrio species. So Vibrio में type species जो है वो that is a bacteria called Vibrio cholerae, which causes a very classical disease known as cholera. Okay. Apart from intestinal disease, Vibrio species can cause invasive infections also, bloodstream infection, particularly secondary to the skin and soft tissue infection. These bacteria are usually considered halophilic. Halophilic means that they require high concentration of salt for their growth. Vibrio cholerae is an exception in that it doesn't require high concentration. It can also grow in culture media which contains low concentration of salt. But the other species, they have very particular characteristic requirement of growing in high salt concentration. So we learn about the manifestation. So what you have to know about after this lecture is that what are the common pathogenic species in the genus Vibrio, what are the epidemiology, clinical features, etiopathogenesis of cholera and its causative agent, that is Vibrio cholerae. What is the diagnostic algorithm for cholera? How to diagnose a case of cholera from a clinical sample? What is the diagnostic algorithm as such? And the fourth is to learn about the treatment and prevention strategies for cholera. Apart from that, the other Vibrio species we will briefly discuss. So main lecture will be on cholera and Vibrio cholerae, but I will cover the other species like Vibrio vulnificus, parahemolyticus. There are other pathogenic species as well. So this is in general the layout. Generally, what are the general characteristics of the genus Vibrio, what are the different pathogenic species, what are the different serotypes, seroepidemiology of the Vibrio cholerae, okay. Then clinical features, epidemiology of cholera, lab diagnosis, clinical feature of this cholera, what is the treatment and prevention, and other clinical manifestation of the other pathogenic Vibrio species and how we diagnose them. So genus Vibrio, in which there is the family Vibrionaceae में there is a genus Vibrio. These are characteristically curved bacilli, gram negative and curved bacilli with a single polar flagella. Vibrio cholerae, some may have multitrichous flagella, but most commonly most of these bacteria have single polar flagella and they are very actively motile, very fast motility, just like you play darts, that you cannot track the path of the bacteria when you see its motility, that is called as darting motility. Practical class jab hogi, so you show them, demonstrate them. You may be having some strains of Vibrio, don't give them strains for handling, but show them in the liquid media the motility, darting motility. Some have multiple lateral flagella like parahemolyticus, alginolyticus, which are responsible for swarming on the culture plates. Which other bacteria give swarming on culture plate? Proteus. Proteus is another bacteria which characteristically give swarming. Any other bacteria, that is the Vibrio, parahemolyticus and alginolyticus. Metabolically they are facultative anaerobic, yani just like E. coli, they are growing, they can grow in the aerobic conditions, but they can also thrive very well under the anaerobic conditions as well. They ferment the glucose without production of gas. Okay. Enterobacteriaceae usually produce gas, Vibrio don't produce gas, and another characteristic of them, just like Enterobacteriaceae, is that reduce nitrate to nitrite. Sometimes you are asked Vibrio how to differentiate Vibrio from Enterobacterials. Okay, some you may be asked. So one of the key biochemical for that is oxidase positivity. Enterobacterials are usually oxidase negative. Vibrio are, most of the Vibrio are oxidase test positive. Another requirement, that they require sodium chloride or common salt in high concentration for growth in culture media, except for Vibrio cholerae. Okay. So these are certain general characteristic of genus Vibrio. Okay. So this is just like the bacteria, slightly curved bacilli. On a gram staining, sometimes it is not easy to appreciate the curved nature, and flagella is obviously not seen. So this is just the structure of a Vibrio species look like. What is their natural habitat? Where do they reside? They are found usually in the aquatic water system and particularly marine waters. Okay. So Vibrio usually bacteria high salt concentration में marine ecosystem में you found them. Cholerae can be found in fresh water and lake water as its NaCl requirement is minimal. That is why it is a much more widespread pathogen. The other Vibrio species are not that common. They are a characteristic association of the patient with the marine waters exposure is usually documented in those infections. Like somebody may have visited a beach, there the patient may have got the infection, a skin and soft tissue injury which had become purulent, and then it can invade into the bloodstream. So usually this kind of history is there with the other Vibrio species, Vulnificus, Parahemolyticus, Alginolyticus. Okay. So usually it is considered a waterborne disease, not a foodborne disease. So it is not as commonly associated with contaminated food, but contaminated water, definitely Vibrio infections are associated with this. Particularly foodborne disease जो है, it is associated again with the marine animals, the seafood. If there is history of seafood ingestion, bacteremia is there, Vibrio species is getting identified. So that kind of history is usually with Vibrio vulnificus and other Vibrio species. One concept is there with Vibrio is that particularly in their natural habitat, they reside in a state called as VBNC, that is viable but not cultivable. Okay. They exist some in this form in which the cells retain certain basic metabolic processes, but from there if you directly culture them on the plated media, they will not be able to grow on such a plated media. So that is called a viable but not cultivable state, and usually from this state they come into the marine, aquatic marine environment, they convert into a bacterial phase, a viable phase, and then if some person consumes such water, they can suffer from the infections due to Vibrio, particularly diarrheal illness. So what is the usual disease spectrum as such? It can be classified into two, intestinal or extra-intestinal, intestinal as well as extra-intestinal. Intestinal are much more common than the extra-intestinal manifestations, that you have to remember. So intestinal manifestation, classic is the diarrhea associated with Vibrio cholerae, and another Vibrio called as Vibrio mimicus, because it mimics Vibrio cholerae in certain aspect, that it is able to grow without high salt concentration. So that is why its name is Vibrio mimicus, because it mimics Vibrio cholerae in that aspect. Then it can cause dysentery as well. So dysentery like manifestation can also occur with other Vibrio species called as Vibrio parahemolyticus. Okay, this can cause dysentery, but these are very uncommon infection, not that common in Indian setting particularly. They are more there in the oriental countries, Japan, China and all, Thailand, and there it is a very common infection. Amongst the extraintestinal manifestation, what are the manifestation? Common wound infection, skin and soft tissue infection, particularly if the infection wound has occurred in contact with salty water, okay, either sea water or marsh water. So wound infection, which can sometimes cause cellulitis, necrotizing fasciitis and even bloodstream infection leading to septicemia. Okay. So these are in general the spectrum of the overall Vibrio species. Vibrio needs to be differentiated from, first I told you, Enterobacteriaceae, then another bacteria because of oxidase positivity, single polar flagellum, very active motility, that is the Pseudomonas. So Vibrio species also needs to be differentiated from Pseudomonas when you isolate them on culture plates. Then two other bacteria which are almost related to Vibrio, showing darting, they also show darting motility, that is Aeromonas and Plesiomonas. So Aeromonas infections also spectrum is just like Vibrio species. It can cause intestinal as well as extraintestinal infection. It is also facultatively anaerobic. It is also oxidase positive. So Aeromonas also needs to be differentiated in clinical lab from Vibrio species. Then Plesiomonas. Plesiomonas का तो नाम ही एक है Shigaloids. Its species name is Plesiomonas shigaloids because it causes an infection, यानी dysentery which resembles that of Shigella infection. So Shigella causes dysentery. So this bacteria also causes dysentery. So it was isolated from suspected cases of shigellosis. So that is why it was termed as Plesiomonas shigaloids. It is also oxidase positive, but it is now, previously it was a member of family Vibrionaceae, but now it is reclassified into Enterobacteriaceae. So for PGs, if you are asked which Enterobacteriaceae is oxidase positive, then the answer is Plesiomonas. When we were MD, we used to say that no exception, all are oxidase negative, because at that time it was considered as a member of family Vibrionaceae. Now it is classified into Enterobacteriaceae. So Vibrio cholerae, I have already told you, comma shaped gram negative rod like bacilli. They are non-capsulated, show darting motility, and based on the, like any other gram negative, it has a O antigen, somatic O antigen, and on the basis of that they are further serotyped, and we will see there are more than 200 serogroups as such from O1 to लेके O200 तक, मतलब उससे भी ज़्यादा जितने अब आ गए हैं nowadays they keep coming up, but these two are the most common, that is the O1 and O139. These are the two most common, and the other ones we call as non-O1, non-O139. Okay. So this is the serological classification of Vibrio. So cholera Vibrios, there is a group A, group B, this is different. Cholera Vibrios mein, they have a common flagellar antigen. So differentiation is on the basis of somatic O antigen, not on the basis of flagellar. Whereas E. coli mein jo serogroups hain, they are on the basis of both somatic O as well as flagellar H antigen. So O1, non-O1. So non-O1 includes also O139. O1 mein again there are biotypes. On their biological properties, two different types of biotypes are there. One is the classical biotype, the other one is the LTOR biotype. Okay. So classical biotype is now not that common. What we see, most of the infection that we strains that we encounter, they show the LTOR biotype. And then further serotype, after the biotype, serotype, Ogawa, Inaba, these are the two serotypes, and again classical also Ogawa, Inaba, Hikozima. So based on the antigen, what is the dominant. So for a clinical lab, it is not that required, but you may require differentiation between O1 and O139. We will see how they are different infection wise. So if you see cholera, a very classical bacteria, lot of literature available in ancient, texts about diseases which are like cholera, and many epidemics have occurred throughout human history. So this came into light, the field of epidemiology, जो हम कहते हैं clinical epidemiology. It started with actually the outbreak of cholera in London, and one epidemiologist, one microbiologist, he was name of Jon Snow, not the one of Game of Thrones. Okay, so this fellow Jon Snow, he found that he located, based on the classical pattern of distribution of patient where they reside, he came to know and he found out the point source outbreak in a water supply tank. So, and this led to the origination of the field of epidemiology. Park, if you read Park, it had described very much, the edition we used to read at least had it, but I hope it is still there. So this was in under 1840s, and it led to the establishment of field of epidemiology. Then ORS therapy, the ORS that we now use for any kind of diarrheal illness, was also initially formulated to treat cholera. What is ORS? What is the full form of oral rehydration sachet? Okay. And then Robert Koch, he isolated Vibrio cholerae from cholera patients for the first time, identified in 1880. So you can see this outbreak of cholera, उस समय तो बैक्टीरिया का ही नहीं पता था, तब भी epidemiology established हुई, and finally the bacterium was identified for the first time in the 1883, okay, by Robert Koch in Kolkata. So cholera, it is a disease, diarrheal illness, which causes characteristically profuse watery diarrhea. Profuse watery diarrhea, motions become 10 to 20 times per day. Water, there is, consistency of the stool is liquid, and it occurs as very point source outbreaks. That means in a few time period, many cases in a community occurs. So which classically indicate that it is a kind of a point source outbreak. Okay. Don't get this notion that Vibrio infections are mainly there in the seashores. ऐसा नहीं है. Vibrio infections are usually there throughout the community in different. Even in MP last year we had an outbreak in a district, but I forgot the name of the district. There we had isolated some Vibrio cases. As such, hospitalized patient may usually, of the own hospitalized patient, we haven't got any case. But from a particular community setting, outbreak, when the samples come, that there is a localized outbreak, we got the many cases as Vibrio cholerae culture positive cases. So they occur as explosive epidemics, particularly in populations who have displaced. जैसे कोई कहीं अर्थक्वेक आ गया, अभी कहाँ है लेटेस्ट अर्थक्वेक, कहाँ पर है? म्यांमार में है, और इधर थाईलैंड और इधर एरिया. सो द पॉपुलेशन गेट displaced, poor hygienic condition, living condition, these such kind of communities are very much predisposed for occurrence of these kind of diarrheal illnesses, okay, due to lack of sanitation and hygiene. It also occurs as pandemics, clonal bacteria spread over continents, okay. So right now we are in the midst of a pandemic, a Vibrio cholerae Altor pandemic is right now going on since last 30-40 years, and we get the cases. So this is the classical timeline of certain pandemics. So India has been the source of most of these pandemics, and this was for the first time during this pandemic, Vibrio cholerae O1 classical was identified, and since 1992, if you see, this Vibrio cholerae O139 pandemic occurred, and it originated from Chennai, India, and right now this pandemic is also going on since last 60 years of Vibrio O1 Altor biotype. Okay. So it is began in the Indonesia. So if you see the world map, these are the continents, particularly Indian subcontinent, the African subcontinent. These are the areas where the cases are so much, and these are the geographical areas, blue in the blue, where not so much Vibrio cases are either indigenously not reported, only the imported cases with the documented travel history are reported. So this African subcontinent, African continent, Indian, Asian subcontinent, Indian subcontinent, all these, this Bangladesh here, all these areas, these are the classical pandemic involvement of Vibrio cholerae cases. So what do you see patterns? Three major epidemic pattern: heavily endemic, neo-epidemic, where newly invaded cholera receptive area are there, and then there are certain limited outbreaks or imported cases happen in a geographical area. Because, for example, if in America, if there is a imported case of Vibrio occurs, it has a potential to cause outbreak in that country because this bacteria doesn't exist there. But imported case कोई आया तो वो तो कैसे transmit होगा? It will go into the water supply. The stool, because it is a diarrheal illness, it will go into the water supply and has the potential to cause the outbreak. So that is why in such countries, it becomes a major, even a single case needs to be reported to the authorities. So what are the different factors for Vibrio cases which occur, due to which the Vibrio outbreaks can occur? One is the environmental factor, that is due to poor sanitation, overcrowding, natural disaster, that we have already discussed. Second is the prior immune status. Sometimes we are exposed to certain pathogens. We may have suffered infection. So what is our prior immune status? It also determines our infectivity. Then antigenic experience of population at risk. उस area में एक तो individual level पे antigenicity, then the population, how much the population is exposed to that particular bacteria, and the other is the inherent property of the kind of Vibrio strain. So there are biotypes. उस particular strain जिसको encounter कर रहे हैं humans, उसकी क्या property है? Whether it is able to cause serious disease, mild disease. Epidemiologically, which is more significant, serious disease or mild disease? Epidemiologically, अगर हमें control measure, control measure suggest करने हो तो what should be our worry? Serious case or mild case? Mild case. Yes, because they go undetected. Often self-limiting illness होगी, patient will have कोई 2-3 दिन के diarrhea के लिए nobody will go to hospitalization until patient suffers from a severe dehydration. Okay, people will, but they will continue to shed the bacteria in the supply. We don't have proper sanitation in facilities in our country. Okay, so it will lead to continuous spread into the water supply. So if you see Indian subcontinent में what is the epidemiology? It is associated with classical periodicity and with the amount of rain. So number of Vibrio cases, they increase during the rainy season. Okay, so rainy season India में कब होता है? We are in temperate climate, so we have July onwards we have a rainy season. So this rainy season and flooding, because it leads to displacement of people also, it leads to the increased number of cases. These are certain factors. Then during the inter-epidemic period, low level get undiagnosed and transiently infected asymptomatic cases. Then bacteria is also able to persist in the environment in viable but non-cultivable state. So you cannot, अब आप सबको तो डिसइंफेक्ट नहीं कर सकते पूरी दुनिया को. एक वाटर बॉडी है, अगर वहां पर एक्वेटिक एनवायरनमेंट में बैक्टीरिया इज एक्सिस्टिंग, यू कैन नॉट disinfect large water bodies. So the bacteria remains persistent in these aquatic bodies, and there is no difficult to control such form. Then they also exist in the form of biofilms. Okay, on the aquatic water body or plantations, they exist as biofilms, and from there in a sessile form, and from there the planktonic forms they keep on get separating, coming into the water body. People drink, animals drink that water, okay, and then get infected. Transmission, I have already told you, mainly it is feco-oral, that is through the water, and direct person to person transmission is relatively uncommon. It can happen, person to person transmission, particularly if the sanitation and hygiene is not good, but usually it is uncommon for person to get it person to person transmission. Now festivals and fairs, they are associated with the spread of disease also. Abhi कुंभ हुआ है, ठीक है, तो that such kind of mass gathering is a risk factor epidemiologically for spread of such disease. Infective dose of this bacteria is usually high. So low infective dose, the symptoms are not much, mild infection, sometimes asymptomatic cases also occur, and they are the predominant ones. If I get infected, I get exposed to a low dose, I will not get symptoms. So infective dose of this bacteria is very high. In contrast to Shigella, Shigella में क्या होती है? It is very low. Even 10 to the power 100 CFU per ml to 1000 CFU per ml infection has the potential to cause disease. Okay. What are the certain bacterial factors due to which it can cause disease? First is the resistance to gastric acidity. So our gastric acidity is a very major factor for us to get, we don't get infection, because most of the bacteria, they are not able to survive the gastric acidity. Feco-oral में सबसे पहले encounter gastric acidity से ही करना पड़ता है. Then they have certain virulence factor which help them to colonize, like Fimbria, toxic, this is a toxin co-regulated pilus, TCP करके एक virulence factor होता है. Without this TCP, the bacteria cannot attach to the intestinal epithelial cells, and bacterial motility in itself is a virulence factor. Then toxin, Vibrio disease is a toxin mediated illness. It is not an invasive disease. It is a toxin mediated disease. The bacteria just gets attached to the epithelium and secretes that Vibrio toxin, okay, cholera toxin, which cause diarrhea. So that presence of toxigenicity, some strains are non-toxigenic, they can also cause cholera, but relatively milder disease. Certain host factors, blood group O, hypochlorhydric state, that is if due to any reason gastric acidity is bypassed, okay, person taking PPI, आजकल बहुत लोग commonly खाते हैं PPIs, कोई लेता है regularly PPI? Any smoker? Nobody will tell. So usually smokers suffer from gastric acidity, so they are in the habit of taking PPIs. So these are certain risk factors, malnutrition. Okay, so all these are certain host factors which predispose for the infection. Clinical features are, as I have already told you, acute diarrheal illness. Just like this is a typical classical stool, rice water stool. Okay, because it is very osmotic. It usually causes a kind of a osmotic diarrhea, where it not osmotic, sorry, secretory diarrhea. Secretory diarrhea because the intestinal epithelial cells, they get exposed to the toxin, and that toxin causes them to secrete a lot of fluid. So this fluid is, this diarrhea is usually painless. So there is no pain as such. Intestinal pain is absolutely not there. and it causes severe diarrhea, but the frequency of motion is very severe, which leads to dehydration, severe dehydration. Okay. There are no pus cells, no RBC in the stool sample if you examine. What is the incubation period? Usually 1 day to 5 days. 1 to 5 days is the usual incubation period. So you can sometimes pinpoint the source also कि वहाँ गए थे या पानी पिया था गंदा, उसके बाद हमें डायरिया शुरू हो गया. Okay. What is the pathogenesis? It is a toxin mediated illness which causes diarrhea, secretory diarrhea. This is an enterotoxin. So another virulence factor is a toxin coagulated pilus, TCP, which favors attachment. Okay, if TCP is not there, the bacteria is not able to attach. So virulence is severely reduced of that bacteria. There are other virulence factors also, but they play a minor role. If you can remember, it is okay. There is a heat labile toxin just like to E. coli. So it is there. Certain colonization factor, hemagglutinin, outer membrane protein, lipopolysaccharide, certain. But what you have to remember is that cholera toxin. That is must know, that is good to know, and these are very good to know. Excellent. Topper हो जाओगे अगर ये याद रह गए, कोई बात. So cholera toxin, what kind of toxin it is? It is a kind of a subunit. It has two components, A and B. And B is multiple unit toxin. A is the active site and B is the binding site. So it helps with the B subunit. This A subunit, it goes inside, this is a kind of a structure. It attaches to these gangliosides present on the epithelial cell. It binds. It will release this active moiety into the intestinal epithelial cells. It will cause some G protein ADP ribosylation, which leads to the activity of adenylate cyclase enzyme, which leads the intestinal epithelial cell to secrete large quantities of fluid. Okay. So this is the general virulence factor. So water moves out of the cells to maintain osmolality. It leads to very severe secretory diarrhea. It is not an invasive diarrhea. So diarrhea pathogenetically क्या क्या होता है? One is the invasive, where the bacteria invades the epithelial cell, causes the inflammation and causes diarrhea. Second is the secretory, where the toxin leads to intestinal epithelial secrete lots of fluid. And third is the osmotic diarrhea, where there is a high salt, मतलब एक osmotic fluid comes into the intestine, and to counter the maintain the osmolality, the intestinal epithelial cell secrete lot of fluid. Okay. जैसा होता है malnutrition इसमें होता है congenital inborn error of metabolism disease के साथ होता है, that is the osmotic diarrhea. So this is the pathogenesis. So if you see the genome of this bacteria, this toxin is encoded by a phage. So classically this cholera toxin was not part of the ancestral Vibrio cholerae genome, but those Vibrio cholerae who are infected with a bacteriophage, CTX5, they become toxigenic. Okay. So naturally the Vibrio cholerae doesn't have this toxin mechanism, but when they get infected by the bacteriophage, this particular bacteriophage, they have this genome for secreting the cholera toxin. Genome is also unique in having two circular chromosomes. There are very few bacteria. Most bacteria have a single circular chromosome. Vibrio cholerae is one. Burkholderia pseudomallei is another one, which has two chromosomes. So ये तो classification है. This classification is called as Gardner and Venkatraman classification. So it usually doesn't have this classification doesn't have the a clinical importance as such, but for epidemiologically this has got importance, and classically also this kind of, you should at least know what is LTOR, what is classical biotype. So, what is the differentiation between usually how LTOR biotype differs from classical biotype? LTOR biotype causes less severe infection, mild or asymptomatic infection. Asymptomatic infection, क्लासिकल में अगर 10:1 का रेशियो है तो एल्टॉर में 100:1 का, अगर 100 people will get exposed to Vibrio cholerae, only one will have symptomatic disease. Okay, so that is why it is able to persist in the environment for such a long, goes undetected in communities. Okay, high carrier to case ratio, and carriers excrete bacteria for a longer period. So once you get infected with Vibrio cholerae, you will be shedding for some period of time in the normal stools. So this can lead to persistence of infection, okay, in the communities. So LTOR biotype has, in this, the humans excrete bacteria for a longer period. Now this O139 serogroup, why it was important? Because one of the thing is that it emerged through the India. So it is also carries, this O139 also has some these toxin mediated, illness and toxin co-regulated pilus, and its disease is usually also mildly protective. Antibodies which are developed against Vibrio cholerae are not that much protective for O139 subgroup. So in Bangladesh in 2002 it causes a large outbreak as such, O139 serogroup. Okay, so this is, so another type of Vibrios are there, that is non-O1, non-O139. How they differ from the Vibrio cholerae O1 and O139 is that they don't have cholera toxin, they don't encode for cholera toxin, they have other mechanism for causing diarrhea, and they don't cause very serious disease, they cause relatively milder diarrheal diseases only, and they mainly have extraintestinal manifestation. So Vibrio cholerae can also cause extraintestinal manifestation, that you have to remember, but these are usually non-O1, non-O139 types, serotypes. Coming to the lab diagnosis algorithm. So diarrheal cases mein it is very simple, what you have to take is, that is the stool sample. So stool sample has to be collected, and you can examine directly, you can see the rapidly motile darting motility, and which are the other bacteria it need to be differentiated from. Campylobacter, another cause of diarrheal illness, another Campylobacter gram negative curved bacilli with polar flagella. Okay, that Campylobacter, Aeromonas, Plesiomonas, Pseudomonas, it need to be differentiated, show darting motility. How can you make it specific? Immobilization with V. cholerae antisera. So just you examined a stool sample, saw the darting motility in the sample, and you add antisera in another drop, this Vibrio cholerae darting motility will be immobilized. The reason why your performance is so poor is that you don't pay attention, you are sleeping. And these lecture are for your own good. ये आपको बेसिक कम से कम तो याद रहेगा. Okay, so very simple test, you can do the cholera diagnosis bench top, on the bench top only. Okay. Then there are certain antigen detection kit, not that commonly used, but there are kits available which can do rapid ICT based detection of O1 and O139 antigen in the stool, just like you do for malaria and the other dengue. Okay. Now for culturing, this is for microscopy, but for culturing, what you have to do is take care of the preservation of the bacterial viability. So for that, the sample ideally needs to be collected in a transport media. Okay. So, what are the classical transport media? That are the V.R. Venkatraman Ramakrishna media, and this is the most commonly used media, that is the Carey-Blair media. For any diarrheal illness, it is recommended that if you want to diagnose through culture, the sample has to be added into the Carey-Blair media. Then third media that you can use for transport is the alkaline peptone water, which we usually normally use as a diagnostic media, as a liquid media also, alkaline peptone, but it can also be used as a transport media. So, this is also an enrichment media. So, these are not, the first two are not enrichment, but alkaline peptone water is an enrichment media, means it will kill the other bacteria and it will enhance the growth of Vibrio species. Okay. That is alkaline peptone water. Then there is another Monsour's taurocolate tellurite peptone water. What are the selective plated media on which we culture? TCBS, thiosulfate, citrate, boiled salt, sucrose, agar media. Okay. So, this bacteria can survive the bile salts, utilizes citrate, not very few bacteria can utilize citrate. Okay. Sucrose is the fermenting sugar, and thiosulfate it can metabolize. So, these are the certain ingredients of this TCBS media, in which the bacteria shows characteristic golden yellow pigmented. Okay. And TCBS is a selective media. If you see, this is the colony. So, the uninoculated media is usually slightly bluish green in color. So, show them the culture. Practical कब है इसका? कल है, थर्सडे फ्राइडे है, तो कल्चर ले लेना, स्टॉक करके रखी होंगी लैब से. यू ग्रो दैम, शो दैम ऑल्सो हाउ डज अ कल्चर कॉलोनी ऑफ विब्रियो लुक्स लाइक. इट इज अ स्लाइटली ट्रांसल्यूसेंट, unlike E. coli colony grows as opaque colony, but it is slightly translucent colony. Okay. And sometimes can cause partial hemolysis on blood agar, particularly Altor serotype. जो Altor biotype है, it can cause partially hemolytic, hemodigestion कहते हैं इसको, these kind of colonies on blood agar. Okay. So, we usually culture this, the sample, whenever we suspect Vibrio, we culture on blood agar and TCBS media plated and alkaline peptone water as a selective and as an enrichment culture media. How do we identify? It usually grows within 24 to 24 hours, the colonies can come. Okay. Selective media से alkaline peptone water again we subculture, because from the top part predominantly aerobic होता है, तो from the top part other bacteria will be killed. We will subculture after 6 to 8 hours. Okay, after usually 6 hours we subculture from the alkaline peptone water, and after growth the colonies we identify using certain tests. Important ones are oxidase. Then there is a string test. I will show you how does a string test looks like. Indole is positive, and sugar fermentation test. So, what is string test? You make a solution of bile salt, that is 0.5% sodium deoxycholate, and add it to the culture suspension on a slide, and it will form this kind of string like appearance. So, this is a characteristic of Vibrio cholerae. Okay, positive string test. Then there is something called as cholera red reaction, where we add H2SO4 to the peptone and it gives another reagent is also added. It is not just some nitrate reagent is also added. So, show them that cholera red reaction. So, it causes a kind of a red colored, it changes to a red color. So, that is called as cholera red reaction. Okay. Then after identification, other biochemical set bhi hai, they will show you what are the different, like indole is positive, citrate is positive, metabolically it will give fermentative reaction in oxidase fermentation reaction, urease is negative. These overall panel of biochemicals is there, that will be shown in practical. After that, what you have identified it is now as Vibrio cholerae. You have to further do the serotyping by getting the O1 or other antisera, particular antisera, that also you show them. Sera हमारे पास पड़े हुए हैं, O1 and other O types के लिए specific antisera. If you want to do further serotyping, then these antisera are also available, Ogawa, Inaba, but ये usually बहुत research lab में रहते हैं, जो particularly research करते हैं इस पे. They have to find out which particular serotype से infection हुआ है. Okay, because it is a notifiable disease. Vibrio is a, what you have to remember is, cholera is a notifiable disease. Even if you identify one case, you have to report it to the health authorities through the IDSP system. Community medicine में पढ़ाया है तुम लोगों की? कम्युनिटी मेडिसिन क्लास शुरू नहीं हुई क्या? हो गई है? तो इन्फेक्शियस डिजीज नहीं पढ़ाया? अच्छा, so there is a system called as IDSP, Integrated Disease Surveillance Program, IDSP system. So through that we usually, certain diseases are listed as notifiable diseases, so they are notified through that. So cholera is one of them, typhoid is one of them, okay, malaria is one of them, dengue is one of them. So there are different diseases. So like that. So this is the biochemical characteristics. How to differentiate Vibrio from Aeromonas? By amino acid utilization test. Vibrio utilizes lysine, decarboxylation करता है, Aeromonas doesn't cause. Because string test is slightly non-specific, Aeromonas can also give it positive, certain strains. So arginine is for Aeromonas, Vibrio is arginine negative. So this is how it is. PG should not click pictures. आप तो पढ़ लो भैया, पढ़कर आया करो थोड़ा लेक्चर में जब आते हो, ब्लैंक नहीं आया करो, थोड़ा सा पढ़कर आओगे तो रीइंफोर्स होगा. बायोटाइपिंग, इफ यू वांट टू डू बायोटाइपिंग, वैसे तो कोई जरूरत नहीं है, लेकिन एग्जाम में कभी कभी क्लासिकली पूछ लेते हैं. हाउ टू डिफरेंशिएट, इट इज अ शॉर्ट नोट. How to differentiate Altor biotype from the classical biotype. So one is the beta hemolytic colonies that I had shown you. They are more common shown by the Altor biotype. Vogts-Proskauer reaction एक ग्राम नेगेटिव में बायोकेमिकल है. VP टेस्ट याद है, MRVP. So VP test is positive by Altor. The classical biotype is VP negative. देन चिक आरबीसी एग्लूटिनेशन, एक चिक के, मुर्गे के बच्चे के आरबीसी को एग्लूटिनेट की प्रॉपर्टी है एल्टोर की. देन पॉलीमिक्सिन बी ससेप्टिबिलिटी. पॉलीमिक्सिन क्लास ऑफ एंटीमाइक्रोबियल ड्रग वी यूज, कोलेस्टिन. सो क्लासिकल कॉलेरा इज ससेप्टिबल टू इट, बट एल्टोर बायोटाइप इज रेजिस्टेंट. सो ऑल दीज आर सर्टेन बायोकेमिकल्स by which you can perform, you can find out which one is the Altor biotype, which one is the classical biotype when you isolate. So they can. Then Fage susceptibility, these are usually done by research lab. Bacteriophage group 4, group 5 susceptibility, accordingly you can classify. How to treat? हुआ lab diagnosis. How to treat? स्टूल से एक चीज ध्यान रखनी है, स्टूल से कभी भी जब हम कल्चर करते हैं, यूजुअली वी हैव टू कल्चर ऑन सिलेक्टिव मीडिया. We have to know the organism beforehand. ठीक है, जब कभी कोई लिखो कि स्टूल कल्चर, सो डोंट राइट स्टूल कल्चर, यू हैव टू अंडरस्टैंड दैट, क्योंकि स्टूल एक ऐसा सैंपल है वेयर देयर आर लॉट ऑफ बैक्टीरिया, नॉर्मल फ्लोरा विल कम. सो स्टूल हमेशा सिलेक्टिव मीडिया पर ही प्रोसेस होता है, और पहले पता होना चाहिए कि साल्मोनेला के लिए करना है, कि शिगेला के लिए करना है, कि विब्रियो के लिए करना है. ओके, लाइक दैट. सो यू हैव टू नो बिफोर हैंड for which organism you want to culture. So treatment, replacement of fluids and electrolyte imbalance. So that is the mainstay of treatment. Antibiotics have supporting role. Even if a patient doesn't take antibiotic, patient can easily survive by maintaining the fluid electrolyte balance, because the bacteria after some time the body can control. Okay, it is a non-invasive disease, but what you have to do, but antibiotics usually are given. It is not that you say कि सर ने कहा कि एंटीबायोटिक देनी नहीं है, ऐसा कुछ नहीं है कि देनी नहीं है. ठीक है, एंटीबायोटिक का लिमिटेड रोल है. मेन ट्रीटमेंट इज इलेक्ट्रोलाइट इम्बैलेंस नहीं होने देना है. ओके, सो ड्रग ऑफ चॉइस इज एजिथ्रोमाइसिन ओरल, सिंगल डोज, वेरी सेंसिटिव बैक्टीरिया, रेजिस्टेंस इज वेरी रेयर in this bacteria, single 1 gram single dose. Other antibiotics you can give, doxy, erythro, cipro, you can give these antibiotics. पहले तो डॉक्सी होती थी ड्रग ऑफ चॉइस, जब से एजिथ्रोमाइसिन आई है इट हैज बिकम द ड्रग ऑफ चॉइस फॉर द विब्रियो कॉलेरी इन्फेक्शंस. प्रिवेंशन ऑब्वियसली ड्यू टू कंटेमिनेटेड वाटर है, सो यू हैव टू ड्रिंक क्लीन वाटर एंड वैक्सीन. सेकेंड इज द वैक्सीन. वैक्सीन अब बहुत बदल गया है विब्रियो कॉलेरी का. पहले तो एक किल्ड वैक्सीन होती थी, ठीक है, और एक ओरल होती थी टाइफोरल, बट नाउ देयर आर सब यूनिट वैक्सीन्स, दे हैव कम. ओके, सो दे आर नाउ, सो दीज ओरल वैक्सीन्स आर देयर, सब यूनिट किल्ड, होल सेल, recombinant BS unit. So this is a killed Vibrio cholerae along with the subunit of cholera toxin. Okay, this can be given. Then there is another Shankol करके आती है, Indian vaccine है. I think it is by the SSI Serum Statins Institute, and it is a bivalent vaccine. O1 and O139 दोनों हैं. Okay, approved for use in children for more than 1 year. But विब्रियो वैक्सीन का एक प्रॉब्लम है कि यू हैव टू गिव रिपीटेडली. सो यूजुअली दीज वैक्सीन्स आर गिवन ड्यूरिंग द टाइम्स ऑफ आउटब्रेक, बिकॉज इंडिया में पब्लिकली आप हर पर्सन को हर 2-3 साल बाद वैक्सीन नहीं दे सकते. सो यूजुअली दीज वैक्सीन्स आर गिवन एंड देयर इम्यूनिटी दैट दे प्रोवाइड, इट इज नॉट लाइफ लॉन्ग, फॉर द टाइम बीइंग रहती है ड्यूरिंग टू ओवरकम द एक्यूट पीरियड. सो इन जनरल दैट इज द thing with the Vibrio vaccines. Then there is a recombinant attenuated vaccine also, CVD 103 HGR vaccine. So these are certain vaccines. This vaccine is recommended for traveler use. So ये वाली इंडिया में उतनी commonly use नहीं होती है. This vaccine, it is mainly in the US where the people travel to such countries where cholera is a endemic. Okay. So there is another, I think टाइफोरल इसमें लिखा नहीं है. This is ये तो डुकोरल है. So this was the parenteral vaccine, पहले होती थी, अब नहीं देते हैं. Okay, there is a टाइफोरल vaccine. Oh sorry, टाइफोरल तो नहीं है, टाइफोरल तो टाइफाइड के लिए. So similarly that vaccine is there, this Shankol. Okay. So what are the other Vibrios? So different other Vibrios. These are now Vibrio species, other Vibrio species. So non-O139 भी extra intestinal कर सकते हैं Vibrio cholerae, that you have to remember. Then the other Vibrio species can also cause extra intestinal infections as well as intestinal. So these are more found in abundance in brackish water, गंदा पानी, sewers, marshes, coastal areas में. So these kind of are associated also with eating raw or undercooked seafood, particularly oysters, shellfish. इंडिया में तो oyster उतने खाए नहीं जाते. Okay, oyster, shellfish, fishes, shrimps, crabs. So they are associated, particularly if you are fond of, because oysters are eaten raw actually. Okay, so so these infections, they are mostly associated with consumption of seafood. So first of them is the Vibrio parahemolyticus. It causes food poisoning. Okay, so it is more of foodborne illness rather than waterborne illness. Vibrio parahemolyticus, and it causes diarrhea and dysentery. Both manifestations can be there, diarrhea as well as dysentery. Severe manifestation is dysentery. How to identify? It shows a very characteristic phenomena, that is the Kanagawa phenomena, in which the strains are non-hemolytic when grown on this kind of agar, Vagatsuma. This is basically जापान में ज़्यादा होता है Vibrio parahemolytic. इंडिया में भी मिल जाते हैं कुछ cases, but उधर की ओरिएंटल कंट्रीज में ज़्यादा है. So strains from the human patients are always hemolytic. This is a culture media in which human blood is used. So on this human blood agar, kind of a agar, the Vibrio parahemolyticus produces hemolytic colonies. Also it causes swarming. एक और चीज बताई थी, swarming भी करता है. Now there is Vibrio mimicus. क्लोजली रिजेंबल विब्रियो कॉलेरी. क्यों? क्योंकि ये सॉल्ट, लो सॉल्ट में भी इट कैन सर्वाइव. ओके, but it differentiate, how it is differentiated from Vibrio cholerae? Negative sucrose fermentation test. So sucrose it doesn't utilize. Vibrio cholerae हम TCBS में sucrose use कर रहे थे. So sucrose fermenting colony उसने इंडिकेटर था ब्रोमोथाइमल ब्लू, उसकी वजह से येलो कॉलोनी दी थी. This will not give yellow colonies on TCBS. It will give blue color colony or greenish color colony ऑन TCBS. सो इसके लिए आपको अलग मीडिया बनाना पड़ेगा आइडेंटिफाई करने के लिए. कॉजेज सेल्फ लिमिटेड डायरिया, समटाइम्स ईयर इन्फेक्शन एंड वुंड इन्फेक्शन, विब्रियो मिमिकस, एंड इट इज नॉन हेलोफिलिक लाइक विब्रियो कॉलेरी. ओके, दैट इज व्हाई इट इज कॉल्ड मिमिकस. नाउ एल्जिनोलिटिकस, द अदर वंस आर हेलोफिलिक विब्रियोज. सो एल्जिनोलिटिकस it can cause again necrotizing fasciitis, otitis. These are the major manifestation. It can also cause gastroenteritis leading to sometimes bacteremia also. So skin and soft tissue infection is the major phenomena, major clinical manifestation, and it can tolerate up to 10% NaCl. So culture media में it can tolerate up to 10% NaCl. Okay, so उसके बिना ये ग्रो ही नहीं करेगा. अगर इसको मीडिया में हाई कॉन्सेंट्रेशन, मतलब मिनिमम 6% तो देना ही देना है. अगर मीडिया में नहीं होगा इट विल नॉट ग्रो. इट इज हेलोफिलिक. ओके, सो दीज आर द स्पेक्ट्रम ऑफ इन्फेक्शन. सर्टेन इट इज एसोसिएटेड विद सर्टेन प्रीडिस्पोजिंग कंडीशंस लाइक एल्कोहलिज्म, लिवर डिजीज, ओके, एंड हीमोक्रोमेटोसिस विच इज iron metabolism disorder. There is a iron deposition in the visceral tissues. So these are certain risk factors for Vibrio alginoliticus. Vibrio vulnificus. Next is, it is also halophilic and one of the major, actually it is the most common Vibrio infection in US, not the Vibrio cholerae. Okay, vulnificus is halophilic and it causes very serious wound infection along with bloodstream infection. It can cause septicemia. So it causes wound infection after contact of open wound with asturine water, where normally the high salt concentration is there. Okay, and again, just like the risk factors, liver disease are a major risk factor for Vibrio vulnificus infections. So this was all about Vibrio species. As such, you can take the attendance. हाँ, तो आप अपने उसमें चलो, उसमें ले लो, अपडेट नहीं है.